Morning, everyone. Thank you so much for being here and joining us here at the Elkridge Fire Station. Over the last couple weeks, Howard County's COVID-19 cases have reached staggering heights. With a near 30% positivity rate and nearly 200 cases per 100,000 residents, this is quite concerning. This is compared to a 3.6% positivity rate and 8 cases per 100,000 just a month ago. The Omicron variant is highly transmissible, which is why testing is still a key factor in beating this pandemic. We've recognized this since the start of the pandemic and have helped coordinate new testing sites with our private partners. In July of 2020, we stood up 2 drive-through testing locations at fire stations in Savage and right here in Elkridge. Then, ahead of school buildings reopening last year, we partnered with the Centennial Medical Group to launch mobile testing sites throughout Howard County. The mobile testing sites were chosen to remove barriers to access for communities as school buildings reopened. Locations are walkable to surrounding communities and along bus routes. This continued partnership allowed us to increase access to many residents who might not otherwise be able to reach testing locations. Our testing capacity has increased significantly since we added these sites, with a consistent volume of more than 7,000 tests per week in Howard County since August, and as many as 12,000 per week in November. In November and December, we saw approximately a 300% increase at our mobile testing sites. And this is while all of us are fighting worker shortages. Many of our friends, family members, neighbors have had close contact with COVID-19 over the past few weeks and are actively seeking testing. With the winter season, it can also be difficult to differentiate between the common cold, COVID-19, or the flu. Additional testing facilities are vital so that our community can slow the spread of this latest surge and protect all around us. More routine and surveillance testing can be especially helpful to stopping the spread from people who are asymptomatic. However, the latest surge driven by the variants has stressed our system nationwide. Earlier this week, we announced a new testing site specifically for county employees and their families, including entities like the school system, the community college, the library, the sheriff, state's attorney, and our courthouses. This will help keep essential services open and help relieve capacity at other testing sites. Since Tuesday, this new location has already tested nearly 750 people. And we're continuing to add sites and target places to continue to take stress off of the system. Today, I'm pleased to announce that we're expanding community-based testing right here in Elkridge, which has one of the highest case rates in our county. Our newest efforts include mobile testing bus and a drive-through option, which you can see is being used already today. This site will be the 7th mobile testing site that the county has added and will operate Monday through Friday, 9 a.m. to 4 p.m. These mobile test sites are especially valuable because it allows our partners to adapt to the changing landscape of this pandemic and to deploy where we need them the most. As we see waves of cases throughout our community, we can shift testing locations and provide additional support to areas where we see larger outbreaks. I want to thank the Centennial Medical Group and First Call Urgent Care for being essential partners throughout this pandemic. Also, I want to thank the Elkridge Fire Department and Chief Pryor for opening your parking lot again for testing. Thank you, Chief. Our partnership with our Department of Fire and Rescue Services has been invaluable, and everyone has worked incredibly hard. Thank you all for always stepping up to help our community. Our community's determination and grit to work collectively to keep one another safe is more important than ever. We must continue to take these individual actions to support the public health and welfare for everyone in our community. And while we are emphasizing the importance of testing today, I want to remind you that the single most effective action that you can take to protect yourselves and your loved ones to stop this pandemic is to be fully vaccinated and boosted. Although we've made significant progress, according to the Maryland Department of Health, approximately 14% of our residents still remain unvaccinated, including our residents 4 and under. And 7% of our residents have received only 1 dose. Approximately 42% of Howard County residents have not yet received their booster shot, which is vital to protect you and those you care about from the Omicron variant. And since vaccinations for children have started in November, more than 40% of our 5 to 11-year-olds still need their first dose, and 60% haven't gotten their second dose. I urge all who are eligible and still not received their full vaccination and boosters to please complete that vaccination series, get boosted as soon as possible. In this race of vaccine versus variants, we can win, and we must win. Thank you.
Good morning. So good to see everyone on this bright, sunshiny day, and great news. And thank you, County Executive. And yes, we will win together with the partnerships that were being announced, like today. And thank you, Centennial Medical Group, for stepping up to expand testing capacity in Howard County. As we continue to see a rise in COVID-19 cases in our community due to the spread of the highly contagious Omicron variant, the need for reliable, easily accessible testing is growing more important. This site will be another valuable resource for community members who are seeking testing opportunities in our county. Reasons someone may want to get tested include if you have COVID symptoms, after a known or suspected COVID-19 exposure, for screening in a school, workplace, or other group setting, before travel, or at the request of a healthcare provider or other public health official. Timely testing is important because it allows our contact tracers to track the spread of the virus, identify those who may be at risk, and inform them in a timely manner to take proper precautions. While we have a team of contact tracers working to contact positive cases and their known contacts, it is important that we act as our own contact tracers after learning of a positive result. Please help us and notify your close contacts so that they may quarantine if needed, following CDC recommendations. The CDC has updated quarantine and isolation guidelines to encourage those who have tested positive for COVID-19 to use an antigen test after 5 days before ending isolation if their symptoms have subsided. The CDC also recommends a test for anyone who is a close contact of someone who tests positive for COVID-19 5 days after their exposure. These steps are important to help confirm that COVID has not spread to those we have exposed or those not experiencing symptoms. In addition to getting tested as necessary, there are other preventative measures that we can all take to protect ourselves from COVID-19 that have increased importance as our case numbers continue to rise. Wear a mask when indoors in public spaces. Frequently wash your hands and disinfect high-touch surfaces. Avoid large crowds. Stay home if you are not feeling well, and get vaccinated. The county executive emphasized the importance of vaccination. Vaccination and booster shots for those eligible remain the best protection against serious illness from COVID-19 and death. Everyone 12 and up is now eligible for getting a booster shot 2 months after getting the J&J and 5 months after getting the Pfizer vaccine and 6 months after getting Moderna. I know, confusing. So for more information about testing and vaccination, you can contact our health department website for up-to-date clinic hours and important information. Thank you for your patience and support during these difficult times. And yes, we will get through it together. Thank you.
I'm happy that I was able to help out with the county on being able to have this site here. My biggest thing is if you could, I know there hasn't been too many people that have talked about this, but if you can take and not call the fire department in reference to the COVID testing, the people downstairs and the secretaries and all here do not know much about what's going on with this. They don't have the times or anything like that. So the number that's on the placard here and the one that's out front here, if you could just call that number and not call the firehouse, that would be great. And for the community around here, if you please bear with us. I can tell you First Call is doing everything they can to kind of keep the traffic and everything else to a minimum here. But like I said, I'm glad that we could help, and be safe.
Good morning, everybody. Just wanted to say a couple comments. Getting tested for COVID-19 is one of the important tools we need to have readily available in order to combat this virus. Working together with our volunteer partners and members of the community to ensure additional testing access is a priority. It's our hope that the return of the Elkridge Volunteer Fire Station testing site will help address this variant surge and will keep more people safe.
I'll be brief. I'll echo what Dr. Ball, Dr. Rossman, Chief Pryor, and everyone else has said. Please get vaccinated. That is our most valuable tool to defeat COVID. Please wear your mask. That's our most valuable tool to prevent spread. And please wear a smile. We will all get through this. I always think of my 6-year-old niece who wears a mask with a smile and goes to school every day. We will win, and I want to thank everyone here. Dr. Ball for being progressive and giving us an opportunity. Dr. Rossman for answering a plethora of emails I've sent her over the last 2 years. And I want to thank our team here who freezes their butt off every day and does their job with a smile along with EMS. Thank you, everybody.
Okay, thank you. Of course, at this press conference, we're here to take questions. Mark Miller is going to assist in identifying who has a question. Kate? Okay, this is a question to First Call and Centennial Medical Group.
I'm wondering if you can, we've all observed the massive volume and testing demand. I know you have the data here, but can you explain what it's been like for your folks who are front-facing with the community and what the demand has been like?
For the benefit of those who are joining us on Facebook, the question is please explain the impact to staffing given the heightened demand for testing.
Sure. So I think Dr. Ball briefly gave numbers where early November it seemed like things were on a good trend. And in the last 2 months, obviously with Omicron, we've seen a massive uptick in cases. In terms of our front-facing staff and our challenges and how we've been kind of getting around it, You know, we've had to adapt and be creative. Our staffing sizes for some of these buses have gotten smaller than they were before. We've had to move buses. Actually, this Monday, when there was a blizzard, we moved our buses to our brick and mortar sites. We've had to deal with, you know, folks in our team being called out with COVID. So we're trying our best to kind of work with this. You know, I think I want to thank our leadership team on ground because they've made it work every day. Our bus has been where it's supposed to be every single day. The volume has been a challenge. It's been a challenge on the front end with the staff that we have here. It's been a challenge on the back end with our laboratory services and our operations. And we're trying to ramp up as quickly as we can. You know, fortunately, we've been able to test everyone that needed to be tested. You know, our 24-hour turnaround time maybe has gone to 48 or 72 hours, but we still try to hit the mark. And to keep things simple, we want to be able to test everyone that needs to be tested. And we will continue to do that. We'll continue to get creative, and you know, the more sites that we're able to have access to with our county partners and with Dr. Rossman, the more people we can test in the county. And so far, you know, it's been relatively successful. We're trying to get better every day.
This question is for the county executive. Go ahead, and I'll repeat the question.
I'm wondering if he is, or the administration is considering entering into the idea of a vaccine passport, and if you're considering adding a booster shot to any sort of vaccine requirement for county employees.
Okay, the question for those joining on Facebook, is the administration considering a vaccine passport or also a booster in addition to any potential requirement?
Thanks for the question. As has always been the case throughout this pandemic, we are going to evaluate every option to keep people safe. Currently, according to our records, we have approximately 85% of our county staff that has gotten vaccinated. But we are seeing throughout not just Howard County, but the state and the nation a lagging behind of the boosters. And as Dr. Rossman indicated, sometimes it can be a bit confusing because based upon whatever vaccine you got, the booster timeline is a little bit different. But we are evaluating all possibilities to ensure the efficiency and the effectiveness of people getting vaccinated, fully vaccinated, and boosted. Any other questions for the media? All right.
I have one more for Dr. Rossman, if no one else has a question. If you don't mind, Dr. Rossman, person of the year. I'm wondering if Dr. Rossman would give us an update on what you're hearing from the state in terms of the therapeutics that might be coming to Maryland, and if you've been hearing about any testing sites or testing locations that, therapeutics coming to Howard County, including any new testing sites or testing locations for health in that regard.
Okay, this is our last question. The question is to Dr. Rossman. If you could please describe any therapeutics that may be current or on the horizon that the state may have talked about, and please also emphasize what may be available here in Howard County.
So I'll talk about the testing first. So the state is working towards increasing capacity across the state by opening up additional sites. They have not yet informed me if one of those sites is going to be within Howard County. So I'm waiting to hear that. In terms of therapeutics, we're hearing right now, some of you, we had the antibodies, but now at least 2 of them are not effective against Omicron, so that's a little disappointing and puts us a little bit behind the 8 ball. However, there are new 2 antiviral pill medications that are on the market and are available by prescription through your primary care provider and available actually at 2 pharmacies located in Howard County. They're very limited, but hopefully ramping up so that anyone who would be eligible and whose provider believes they would benefit from would get it.
Thank you.
Thank you all.
And this concludes our press conference. Thank you to those joining on Facebook, and thank you to the press here today. Thank you.